Okay, so 250,000 people are affected by sepsis every single year, and 44,000 of those people will die. 10,000 of those are children, and 1,000 of those children will die. And it affects more people than breast cancer, bowel cancer, prostate cancer, and HIV and AIDS combined. From the research that we've done previously, what we do know is that if we give treatment within the first hour, those patients that have had treatment compared to those patients that don't, their mortality is less than half. So ultimately, whilst we wouldn't be able to say how many, we estimate we could save around 14,000 lives every year. We need recognition, we need our clinicians, we need our junior doctors, our junior nurses, we need them to understand what the signs and symptoms are. We need them to understand when patients come in, if relatives are concerned, because that's one of the biggest things. You know, it's our first face-to-face contact with the patient. We don't know the patient, we don't know what they're like normally, but for the relative that's sitting by the side of them, if they're saying to us this isn't normal for them, then we need to start taking that on board. But we also need to be able to recognise it ourselves, and we also need to be able to treat it. So we need to know what triggers it, what our triggers are, and what is out there for us to use. So do we have screening tools out there? We have them in our trust, but they're not in every single trust. When they're used, are they used correctly? What are they used in conjunction with? So if your relative has got signs and symptoms of an infection and just doesn't seem to be getting any better, so if it's been going on for a few days, are they different to how they would normally be? Are they struggling to breathe? Do they have a temperature? Are they cold? Are they shivery? Do they just look generally unwell and then just not getting any better? And also, as a mum myself to a child that has had sepsis, at the time when Thomas had sepsis, I knew he wasn't right, but everybody that I was telling me that it was just a virus and that he was fine, until I actually took him into my own hospital and was seen by a very senior doctor who said, no, actually, you have done the right thing. Don't be afraid to challenge. You know, go with what you see in front of you. Go with your new score or your mu score or whatever scoring system you use within the hospital, and start to screen the patient. Get that screening tool out and start looking through it and just seeing where the patient fits within it. It might not be. It might be something completely different. But at least if you've looked through and you've gone through the screening tool, your patient has a much better chance of that diagnosis being correct.